Welcome to this presentation on using the Community EMR to maximize your ABCDEs, presented by Dr. Alex Singer from Family Medical Clinic. This video will discuss the functionality within the Community EMR that will help to achieve the ABCDEs of diabetes management. For more details on the ABCs, please see the Diabetes Canada website.
Hi, welcome. So I'm going to demonstrate some features of the Accuro EMR that might help you manage patients that have diabetes, and in particular, keep in mind some of the ABCDE2S features of the new diabetes guideline that you may want to pay attention to and use your EMR to help prompt some of those parts of a patient's care. So we'll start from this home screen. You'll notice that we can open up an encounter note from here, and that we can view the patient's labs here along a column line. In this case, I've created a diabetes view that ranks HbA1c at the beginning and some other features. You might also use something slightly different, like a comprehensive view that has more labs available, structured slightly differently. This is nice because it shows us some of the labs that might be out of range. So we'll go ahead and open an encounter note as if we've taken a patient's history, which we would enter here. But we may want to use our EMR in this case to identify some features of the patient's care that we should be taking care of at today's diabetes visit. So if you scroll your eyes over here to the primary care quality indicators, you can just hover over the diabetes view, and you can see that there's a few things for this patient that haven't been done for quite some time. And so that might prompt you to want to open up a lab requisition. In this case, I have a quick access button to do a lab recs down here. And you can open up a lab rec and add some information for a patient so that they can have their HbA1c collected and their cholesterol screened for. Let's also assume that we've taken a blood pressure and that their blood pressure was 130/80. If we capture that blood pressure over here, it's not going to remain in our EMR in a coded way. So what we'd like to do is create it as a new lab over here, and blood pressure in this case is captured under physical history. And so we'll add a blood pressure this way if we add it 130/80, and now we'll just hit OK, and now that blood pressure is down here in physical history, and actually if we drag and drop, we bring that blood pressure into our EMR. We've entered several others today, so the blood pressure is captured a few different times. The other thing we may want to capture is the patient's lifestyle status, whether they smoke or do they do any exercise. And you notice if we scroll down here at the bottom of the screen that we've done some of those things today already, but let's say we wanted to change some of them. We just click right on there, and it shows here that the patient is not a tobacco smoker, but maybe we want to add some details. So no exposure to secondhand smoke, and we can save and close. We could also delete this and enter a new one. In the case of exercise, we have some details around the exercise. We may want to change those things. Say that patient has recently increased their walking and now they're walking 10 kilometers a day. And we'll save and close, and you'll notice those things change down here. When we save our note, or if we hit OK, what will happen is those changes will appear on the right hand side of our screen and be available for the next time we're seeing this patient. So those are just a few examples of some features you can use to help prompt and best capture some of this information. We'll cover some other aspects of diabetes care, such as doing queries to do advanced care and quality improvement, and the use of forms, and we'll capture those in some other videos. Thanks.